swine flu this fall. What impact is it going to have in both of your cities, especially this question of whether schools should be closed as a result?
We dealt with the swine flu this past spring. We made the decision repeatedly whether to keep a school open or closed, depending on the percentage of kids that reported to the nurse with a fever and cough. The experts basically say if the child appears sick or you appear sick, stay home until the symptoms go away. But closing the schools isn't the right answer in most cases for a variety of reasons. One, the kids probably aren't going to stay home. They're going to go to the park where they're just as likely to catch it. Two, remember, a lot of parents have to work, and missing a day of work to take care of the kid, or worse, leaving the child home unsupervised, puts the child in danger or hurts the family. And number three, there's just no evidence that it really stops the flu. A lot of this is, by the time you find out, people are already infected. The good news is this has been a relatively mild version. The bad news is we don't know what's going to happen before. But even the president recommends that we keep the schools open, and the Center for Disease Control, now run by my former commissioner of the Department of Health and Mental Hygiene, has said basically evaluate it every time, but closing the schools as a blanket thing is not the right solution.
But let me just add to that, because again, we have to do the basic blocking and tackling that's going to protect our children, especially from this challenge. But I don't want to lose something that Mayor Bloomberg has been a national leader on. We can't allow the challenges of today distract us from the opportunities of tomorrow. The real health crisis going on in our schools right now, and again, we need to give full attention to swine flu, but the real health challenges in our schools today is the overwhelming obesity problems amongst our kids, type 2 diabetes appearing, and childhood diabetes. And these are the kind of things that we have to have a comprehensive health initiative, education initiative. So not only parents know what to do if their kids have the sniffles, but I also want parents to know what to do to prepare their kids to be nutritionally fit to learn. And we as Americans have a comeuppance, because the long-term health problems that are facing our kids today that we could address are going to have an effect on our GDP in the level of billions.